Bottle refusal is a topic that I get asked a lot about. Bottle refusal when you have a breastfeeding baby can be a complicated, tricky, complex discussion because it's really not one size fits all. But I'm going to do my best today to talk briefly through bottle refusal, some strategies that you can try, and some other things that we can do to try to help. So let's kind of talk back through the basics. Breastfeeding and bottle feeding work completely different. They actually physiologically use different muscles. Breastfeeding uses more of the jaw and tongue, and bottle feeding uses more of the lips and cheeks. So your baby actually needs to do different things with their mouth in order to be able to breast or bottle feed. When we have a baby that's refusing a bottle, the number one question I need to know is, how old is your baby? If your baby is under 6 to 8 weeks, they are relying on reflexes to suck and swallow. If you have a young baby who's still using reflexes to suck and swallow, there's something usually anatomical or physiological going on, or it could just be as simple as you're using the wrong bottle, because those babies have to suck because that's the reflex that we're triggering. So if you have a baby under 6 to 8 weeks refusing a bottle, number one, go work with a lactation consultant or a pediatric feeding therapist to figure out why. But most common reason is there's an undiagnosed tongue tie where they may be functional at the breast and they're really struggling at the bottle, or it might be as simple as you're using the wrong bottle. So bottles like these that have straw-like nipples are very difficult to latch to. While they're marketed that they look like the breast, feel more like the breast, in reality, they don't function at all like a breast nipple. So under 6 to 8 weeks, switching to a more tapered nipple that promotes a more similar latch to the breast can be really helpful. So using a more tapered nipple, this one can work okay. Longer nipples can gag babies a little bit more, but using a more tapered nipple can really help. When at all possible, when introducing a bottle, make sure you're using freshly pumped milk. And if you're using frozen milk, it could be as simple as taste it. Has it oxidized where it tastes metallic or fishy? Or is there possibly high lipase, the enzyme that breaks down milk that's making it taste more soapy? If you are truly struggling to get your little baby under 6 to 8 weeks to take a bottle, please reach out to a local IBCLC lactation consultant or speech, occupational, or physical therapy, because there is a reason why your baby's not taking it. Now, over 8 weeks, the reflex for sucking should be integrating, meaning your baby should know how to suck now. Sucking as a reflex basically is a blueprint to teach your baby over and over and over that stimulating that suck, that they then now learn how to suck. So from about 8, 10, 12 weeks on, your baby now knows how to suck and gets to choose what they suck on, and they switch to the instinct of chewing. The reflexes for chewing come alive so that they can practice chewing for 2, 3, 4 months before you put a solid food in. So again, little tiny babies who aren't bottle feeding, something's going on because they should be practicing sucking. Older babies, we're not holding that against them. If they don't want to suck on this because you've never introduced it, it's because they want to chew on it. So if you're introducing a bottle at 3, 4 months and they're just like, they can't latch to it and they can't chew on it, that's a totally different baby. They want to chew on it because their reflexes are telling them, practice chewing anything that goes in my mouth so that when a solid food is put in my mouth, I chew it before swallowing. So if you have an older baby refusing a bottle, that's a whole other strategy, okay? So if you've never given your baby a bottle under 2 to 3 months and you're going back to work at 3 to 4 months, then totally different ballgame. Again, we want to be looking at the nipple size and shape. I will always prefer a tapered bottle nipple that promotes a latch more similar to the breast. When I'm working with families for bottle refusals for 3, 4 month olds who want to chew, number one strategy, take that nipple off of the bottle and just have it present and around while you're breastfeeding. Let them play with it, let them touch it. give them lots of opportunity to see that, because we don't want to just have them be like, this is how I fed, this is how I feed, and then all of a sudden you put them in a totally different context. They don't know what this is. They don't know it's for feeding if they've never seen it before. So get it out while they're feeding so that they start to associate, that comes out when I eat. That's something that can be used while eating. And then have them practice and play with that nipple in their mouth as if it's a pacifier. You might have to put a finger in the back, but touch their gums, play with it. Happy, happy, happy. This is something that you can put in your mouth. They may or may not suck on it. That's fine. But they need the exposure and the experience to start to associate. This is something that can go in my mouth. You can also get your finger in their mouth, practice with other teethers and toys so that they learn other things can go in their mouth besides just their hands and the breast. When you do go to offer them those bottles, absolutely check to make sure that it's not something with the flavor of your milk. And if you've been exclusively breast milk feeding, don't suddenly switch to formula to offer them those first bottles. Stick with your own breast milk first. When I'm basic of bottle refusing, I am not pro just let the baby starve because they'll eventually take a bottle. Not true. I've seen a lot of babies that will starve themselves and not be able to take that bottle. So I don't like that as a strategy. I am also very pro have mom give the bottle. I know a lot of people will say have dad or a caregiver give the bottle while mom's away. Mom has been the source of food. Babies know cause and effect when they're older than 3, 4, 5 months. They are associating mom is where I get my food from. So my favorite strategy, just as a quick and dirty for teaching, is to pop baby into football, get your breastfeeding pillow around you, latch the baby, make sure your milk is warmed up to body temperature so that it's the same temperature. We're not working with cold milk. And do a bait and switch at the breast. So have mom start feeding. They now are used to having this bodily nipply thing around because you've been working on it as a pacifier, introducing it, and pull them off and use the bottle at the breast. And if they have any panic, put them back on the breast. So it's bait and switch and bait and switch. The goal, if you have a bottle refusing baby, is not to get them to take big volumes out of the gate. It's to get them a positive experience with something other than the breast. So as soon as they are like, what is this? I don't know what's going on. Put them back at the breast. You can work on volume later. It's really hard to come back from an aversion where every time the baby even sees that bottle, they're arching and fussing. So those are my number one strategies. Under 6 to 8 weeks, if they're not taking a bottle, if they're refusing, something's going on, please seek professional help right away. If they're at 3 months on, try a bait and switch at the breast. Get them used to this nipple outside of just them trying it. Have it in their mouth like a pacifier. Have it around while you're breastfeeding so they're touching it, seeing it, associating it with feeding. And then try really warmed up milk that's fresh at the breast in small amounts. If at any point in time your baby automatically is like, nope, but they start arching and fussing, stop and seek professional help. So it's really important that we keep that bottle as positive as possible. We can work on acceptance of volume if they have a positive experience, but really essential to make sure that it's positive. I do recommend that if you have to go back to work around 3 months, to get a bottle in early and keep it in with consistency. So 3, 4, 5, 6 weeks, introduce your bottle and then keep it in routinely so that when they cross from suck as a reflex to chewing as a reflex, they have those skills maintained so that it's not some new thing. Okay, so those are my basic bottle refusal strategies. If you have additional questions, I do lots of bottle refusal consultations virtually, so don't hesitate to come on and schedule an appointment with me so we can work on other different strategies based on your unique situation. And now you know. Now, another thing is if you are a speech, physical, or occupational therapist working with babies and bottles and bottle refusals, I do co-teach a professional course on bottle refusals with an occupational therapist where we do a deep dive into many other strategies. We talk about positioning the sensory system, other therapies and strategies and exercises to help those really challenging cases that are more than just simple. So for your simple cases, parents, all of those strategies that I just talked about can be really helpful. For therapists out there, if you are seeing more complex cases, go to thelactationot.com where you can find my bottle refusal class for more information. All right, thanks everybody. Bye.